Ever pondered over why some people have to constantly keep their sweet tooth in check? What is it that makes a slice of cake a potential hazard for them? The answer lies in a sneaky condition known as diabetes. This is a tale of two hormones, insulin and glucagon, and their tumultuous relationship that leads to the onset of diabetes. Produced by the pancreas, these hormones are vital for managing the body's blood sugar levels. Insulin is the good guy, helping our cells absorb glucose from the bloodstream. Glucagon, on the other hand, increases blood sugar levels when they drop too low. Imagine a scale, delicately balanced by these two hormones. Now, envisage a heavy weight being placed on one side of the scale, tipping it off balance. This is analogous to what happens when the body doesn't produce enough insulin, or when it fails to use the insulin it does produce effectively. This imbalance leads to an excess of sugar in the blood, a condition we call diabetes. In the world of diabetes, there are two main characters, type 1 and type 2. Type 1 diabetes is an autoimmune condition where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This type is often diagnosed in childhood and requires lifelong insulin therapy. Type 2 diabetes, however, is more often seen in adults and is closely linked to lifestyle factors such as obesity and physical inactivity. In this case, the body either doesn't produce enough insulin or the cells become resistant to it. The symptoms of diabetes can be as subtle as a whisper or as loud as a thunderclap. Unquenchable thirst, frequent urination, unexplained weight loss, persistent fatigue, blurred vision, slow healing sores, and frequent infections are some of the common signs. To diagnose diabetes, medical professionals use three main tests: the fasting plasma glucose test, the oral glucose tolerance test, and the hemoglobin A1C test. These tests measure how well the body manages glucose after fasting, after a glucose-rich drink, and over a 3-month period respectively. Now the million-dollar question is, can diabetes be cured? As of today, there's no known cure for diabetes. However, it can be managed effectively through a combination of medication, a balanced diet, regular exercise, and maintaining a healthy weight. So, to recap, diabetes is a chronic condition caused by an imbalance in the body's insulin production or use. There are two main types of diabetes, each with its own causes and symptoms. Diagnosis involves various tests that measure the body's ability to manage glucose. While there's no cure for diabetes, it can be managed effectively with the right lifestyle changes and medication. Remember, knowledge is power. Understanding diabetes is the first step towards managing it, so take charge, stay informed, and live a healthy, balanced life.